Laurie and Jess, and just all of you for coming. So if you don't mind, we're going to stand for the pledge of allegiance and then stand for the leaders in prayer.
Flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Gracious and awesome God, we thank you for this surrounding of great people, bright, colorful people in red. We love that you need to support Laurie and Trinity. And we also ask that you remember that this too is about the American Heart Association. We greatly appreciate the awareness that we are spreading and that we are raising. We love to do service, so please seek out for each of us to do a service in your name, God. Thank you. Amen.
Okay, now, and I do want to mention that we do have 3 women of impact. You all know Laurie. We have Emily Earl. They're posted on the back of the window, and you can right where Jeff Kelly is. They have a light. You can scan that QR code and make a pledge. So now, Mark.
Thank you all. It is an honor to be with us. We actually have 5 of us here. The other 2 are the storage. She did also friends who is the cavern coordinator for they were unable to come. Crystal, unfortunately, with surgery and paradox. But we are thrilled that you are here. And to be very clear, this is not about Laurie Labishak, Emily Shortall, Pam McKim, or any of the other nominees across the country. This is about women and heart disease. When I was nominated or invited to be a nominee of this campaign, and I looked at the statistics, it was absolutely startling. I've worked in healthcare for over 30 years. I did not know that 1 in 3 women die of cardiovascular disease. 1 in 3, ladies. Look to your left. Look to your right. Most of you are women at these tables. 1 of you will die of cardiovascular disease. That's more than all cancers. We don't talk about it. Well, I want to talk about it. I want to talk about the women that it has impacted in my life. My mother has a pacemaker and has congestive heart failure. She lives in the wonderful state of North Carolina and has received incredible care. My father, career Marine, didn't retire until he was 80 degrees. He's probably 80 degrees. He was still running. I mean, running. I couldn't keep up with him. 3 miles a day and doing 100 push-ups. He had a little bit of angina. Went to the doctor sent him to a cardiologist. He needed bypass. Incredible to me because he's the epitome of health. Again, we don't talk about it. Every single member in my immediate family, brother, both of my sisters, my mom, and myself, have high blood pressure. We all take medicine for it. I didn't know what an important risk factor that was and how important knowing my numbers are. So what has this campaign meant for me and done for me as an individual? I know my numbers, and they're not good. They're not good. I know I need to make some serious changes, and I have. The last 3 weeks, I have been very mindful of making changes that will impact my life for the long run. And I encourage you to do the same thing. If you're on social media, there is a campaign out there. Emily, Pam, Erica, and Crystal and myself are really trying to make an impact on social media by sharing statistics, by sharing tools that all of us can use that are available from the American Heart Association. There's an incredible tool where you can go and check your heart score. Let me tell you, that was an eye-opener for me. Because, yeah, I knew I have high blood pressure. Yeah, I know I need to lose a couple of pounds. I had no idea that my heart score was so. Ladies, gentlemen, take the test. After you take the test, you will be incredible steps that you can take to. And I challenge you. If you're sitting here today and you think, well, I eat a pretty balanced diet. I watch my weight. I do all the right things. Please take the test anyways. There are some questions on there that may surprise you. Use my dad as an example. He was the epitome of health, but his heart needed help. He was 76 when he had his quadruple bypass surgery. During the pandemic, one of the grafts failed and he had to have a stent put in. But he turns 81 on May 2nd, and he is back to running 2 miles a day and 50 push-ups a day. And he's convinced that he's going to get back to 100 push-ups. He's an incredible man. There are a lot of things that we can do in our community, and one of the things we can do is advocate to our legislature and our political leaders. Our government leaders have the ability to pass laws and initiatives that can help people take control of their lives, empower people to embrace the things that are available to us every day that cost nothing to help us live healthier lives and decrease the incidence of heart disease. 1 woman in every 3, ladies, is too many. We don't want to lose anyone. We don't want any person in this room to die of cardiovascular disease. I am honored to be an advocate for Trinity Health System. We have an incredible cardiology team, cardiovascular team. It's growing every day. We're seeing new technologies, new programs coming about all the time. And because of the team that we have built and continue to build, led by Kelly Bedham, our service line director, this team is really taking the charge to combat heart disease in our community, to treat people who need treated, to give them life-saving care. As the marketing director for Trinity Health System, I have the privilege of introducing to you Dr. Tristan Smith, who is the director of our cardiovascular program at Trinity Health System.
Good afternoon, everyone. I was going to make some prepared remarks, but I know coming after Laurie, I know she'd have done such a great job that, preparing anything wouldn't have made sense. So I just want to have just a little conversation about what we're doing at Trinity Health and what you can do in the community to make sure that we have healthy hearts, healthy lives, and that the women in our lives and the women in our communities are well taken care of. That statistic, 1 in 3 women dying from heart disease, is pretty stunning. When you look at all cancers combined, 1 in 3 women dying of heart disease is worse than all cancers combined. Not only that, we're seeing a lot of heart disease in younger patients. 44% of females older than 20 years old in the US have some sort of heart disease. 50% of all women who are becoming pregnant have some sort of heart disease. 10 to 20% of them will develop some sort of complication from heart disease during pregnancy, whether it be eclampsia, preeclampsia, gestational diabetes, And we now knowing that when they develop these conditions during pregnancy, it lasts throughout the lifetime. So we have to be more diligent in what we do. We have to be more diligent in the way we screen. We have to be more diligent in the way we educate. Because many times women come to us and patients come to us and it is just too late because the signs and symptoms of heart disease in women are just so different. We are very, I would say, unfortunately, in a situation where most of the signs and symptoms and everything that we have in the literature regarding heart disease has been dominated by men. So left-sided chest pain, radiating to the arm. Most men get that. Many women don't. So when we're looking for what we call the typical signs of heart disease, they vary. They vary between men and women. Women go through menopause. Men don't. And that menopause in itself isn't a marker of heart disease and it doesn't cause heart disease, but the hormonal changes that happen during those periods can affect the heart. And we as practitioners, we need to understand that. And you as females need to understand that. And sometimes we're frustrated as physicians when women come to us and they have these atypical symptoms and we're like, there's something going on. There's something happening here. We need to investigate it further. But because it's not chest pain that is typical for heart disease, we try getting some tests and so on approved through the insurance company and they would say no. So that's why legislation is important. That's why education is important, because we have to raise awareness that it is not just a matter of chest pain. You women are complex. Women are complex. And there are a lot of other factors that go into how we treat heart disease in women, right? Women are less likely to be revascularized, less likely to have a stent placed, because, again, our literature has been dominated by men. When an older 85-year-old lady comes, she looks frail, she's less likely to get the sort of treatments that we would give to an 85-year-old man because he looks a little stronger. So we as physicians have to reset our minds and what we do, and you have to be advocates for your families, your friends, and the women in your life. One of the things that we can do to make an important and immediate impact in the community is learning CPR. We have simplified the way CPR is being done. We've now gone to hands-only CPR, so we don't have to worry about giving a rescue breaths. And that is very, very, very important for all of us to know. The statistic that you need to know for this is that for when someone has an out of hospital cardiac arrest, for every minute that passes without effective CPR, the chances of death goes up by 10%. So for every minute without CPR, the chances of recovery for that patient decreases by 10%. So in 10 minutes, if there's no CPR for 10 minutes, the mortality rate is basically 100%. So if we can get to those patients quickly, quick assessment, start CPR, hands-only CPR, it doesn't need to be anything fancy. You put your two hands together, place it on the chest, just above, just in the middle of the chest, hunched over, and you give about 100 to 110 compressions a minute. I think we have a video here that we're going to show. That's
part of the part. You were just part of the what, 55 people in here, that's 5,500 points for our campaign. If I may, if
So what I want to say is challenge us, challenge one of us, challenge, get out of your comfort zone, don't be afraid of exercising, don't be afraid of asking difficult, tough questions of physicians. Don't be afraid of challenging your friends, mom, your aunt. Challenge them to be there, to be more helpful, to be educated, understand their numbers, and to understand that heart disease is very prevalent and they can do something about it. Living a healthy lifestyle is tough. And it's expensive. But we need to focus in our hearts and our minds that this is something that we want to do and challenge ourselves. So since I'm going to challenge you that I also want to get out of my comfort zone. So I was thinking of what could I do to get out of my comfort zone with a group of people. And I said I need to do something that I've never, ever, ever done. So about a year ago, over a year ago, I started a Trinity Health system, job, responsibility. Working the rooms there was stressful. And one day I'm gonna fight. So the last round, I'm gonna third place round. And it was an honesty, it was like 6 months. So I'm online trying to find one. There was a place in Akron that I called, it said it's gonna take 6 months. There was another place in New York I called, it said it's gonna take 8 months. I can't wait that long. So it was an honesty to get a still round here. And I finally got it about 2 months or so ago. So when Laurie told me she was going to be here, I said, I'm going to challenge myself to learn one song to play for this audience. So I'm not a professional musician, but I'm getting out of my comfort zone. Instead, I'm going to play on the steel drum. Baby Girl. Sometimes I'm teaching, so
Smith has a hidden talent that is now hidden. I will tell you, I told Dr. Smith a little lie. He didn't lunch. I told him I didn't tell him. And he said, don't tell anyone, let it be a surprise. But I actually did tell my mom. Now keep in mind, my mom is 80. And I said, I gotta tell you what Dr. Smith is doing, because he told me not to tell anybody, and I gotta tell someone. Because women are complex. And I said, so he's gonna play the lady in red on Steel Rooms. And she went, he's gonna dress up like a lady in red? I said, so again, thank you all for coming. Yes, this is about raising awareness and it is about advocacy, but it is also about raising funds. As Wendy mentioned, at the back of the room, there are QR codes that you can scan to give to my co-nominees, Emily Shortall and Graham McKim. You can also purchase raffle tickets. We are raffling off a large screen television, a beautiful Brighton heart necklace that actually was designed for the American Heart Association. We have a $400 package to Ogilvy Park. And remind me of the last thing.
Beautiful red Coach bag.
Oh, that's right. Valley Hospice donated a beautiful red Coach bag. How could I forget? So we would love for you to support these campaigns. There are lots of activities happening. Please follow all of us on social media. To give you a little highlight of what's coming up next Friday, we are taping the Buckeye Mobile Principal to the Wall. So we have the local school getting involved in raising funds for the American Heart Association. We also have a Go Red Luncheon in Steubenville on March 25th, which is where we will give away all of those wonderful prizes. Table sponsorships are available as well as individual tickets. Please let us know if you're interested. And the final fundraiser will be on April 3rd at the Bridge Tavern on Main Street in Wheeling. And it is a honky tonk sweetheart concert for the American Heart Association. Dr. Smith may make an appearance with his. At this time, I'd like to invite both of you, please. Thank you for being on this journey together.
All right, can I ask, is there any questions? Does anyone have any questions for Dr. or anybody, about art, and have issues with, or you have questions? Yes, Fred. I just don't know that big.
I just would like to make a statement that, I had a stent put in back in 2020 and Trinity Hospital truly saved my life. From the emergency room all the way through rehab, and I still go there today for checkups. So, they're phenomenal. Thank you very much.
So the doctor said we're not where we need, so we're complex. So you didn't have the typical chest pain. You said you didn't have anything that was typical. So what was your sign?
My actual sign was, well, actually, it started on Thursday. Started bad on Thursday, but of course, you know, as women, we're like, oh, I'm just tired. Keep going. Well, I made it to Sunday, and I went to sleep, and I didn't think I had shortness of breath, but I did after. You need to pay more attention to that. I did have it because after I had my step put in, my breath